In the name of Allah, the most gracious and the most merciful, may peace, mercy, and blessings of Allah be upon all of you. Mental hygiene concept and importance in education. It is being realized by all progressive educators that the goals of mental health and education are similar. The aim of education is an all-round development to human personality. It is to help every individual become a well-adjusted being in his society. Mental health is also concerned with the harmonious development of personality. Therefore, they complement each other. Moreover, feelings and emotions are being recognized as key factors in growth and development, including learning in out educational institutions. Feelings and emotions are the driving forces behind the ways people behave. Behavior is complex and its causes are deep rooted personal and societal experiences. Another evidence of this standpoint is the assumption that expression and release through worthy creative endeavor is demanded by growing minds and bodies, and that consideration must be given to basic human needs in the development of curricula and the selection of subject matter and experiences for children. Working in education is exciting yet highly demanding, especially when learners are in the picture. Mental hygiene health in schools. The statistics regarding youth's mental health problems are staggering. Approximately 20% of young people may be suffering from some form of mental disorder, which translates to 1 in 5 students in the average classroom. These include depression, schizophrenia, anorexia nervosa, bipolar disorder, panic disorder, etc. As an educator, these numbers illustrate the potential that these problems seriously impact the day-to-day functioning of youth in the classroom. Mental disorders represent the most common and disabling condition affecting young people and therefore have major implications for students and for schools. Mental disorders affect a student's emotional well-being. If ignored, mental health problems can impede social development, leaving young people feeling socially isolated, stigmatized, and unhappy. In an attempt to cope with or overcome the symptoms of these disorders, some young people acquire socially or personally inappropriate behaviors, such as dropping out of school or becoming heavily involved in the illicit use of drugs. Mental disorders may also impact the young person's ability to make and retain a strong and supportive peer network or appropriate relationships with adults. Teachers represent a prominent and positive adult role model in the student's life. It is part of their role to be supportive and aware of student difficulties and direct them to the appropriate resources for help if needed. Promotion of mental health in teachers and learners. Why teachers' mental health? Unlike other professionals, as the teachers deal with living human beings, they should keep extreme mental health. Any sort of mental disorder of teacher may affect the mindset of a learner too. Moreover, if she if he she has not a very good mental health, he she cannot deal the classes effectively and usefully. The following steps can be taken by authority to ensure The mental health of teachers. Number 1, arranging meditation yoga session. Number 2, clarifying the roles and responsibilities. 3, providing time for relaxation and between school hours. 4, ensuring good relationship at school. 5, providing reasonable support. 6, reducing workload. 7, avoiding public insulting. 8, avoid staying up late night. 9, avoiding excessive watching of TV and use of cell phone. 10, sticking to own roles and responsibilities. 11, keep good relationship with colleagues. 12, finding time for small talk with family members. 13, avoid tussles with colleagues. Why students' mental health? Learning is a task which occurs effectively only when the learner is equipped with interest, concentration, attention-free mind, confidence, inspiration, etc. Hence, learners' mental health is an inevitable factor in the teaching learning process. The following steps can be taken by authority for the promotion of mental health in learners. Number 1, making inclusion in its real sense. 2, reducing the content of the curriculum so that to make it comfortable for the learners. 3, creating very good rapport between the teacher and learner. 4, providing proper time for refreshment. 5, providing proper support when it is needed. 6, avoiding public interest. 7, offering proper clarification of doubts. 8, providing time for proper recreation. 9, accepting the concept of synergy when giving assignments and projects. 10, ensuring the learner is not indulging in excessive watching of TV, using mobile or playing video games. 11, conducting field tours. 12, making use of culturally responsive pedagogy. 13, creating learner friendly atmosphere in school campus.